Hello, I'm Dr. NaNotchka Chumley, family medicine physician from Los Angeles.
All right, Dr. Chumley, we are here at the National Medical Association 2018 conference. And first question, what is killing Black folks? What are the top things that are killing our community?
That's a great question. I would say stress, high blood pressure, and diabetes.
Okay. And what are some of the things that you would like to see just differently from your patients?
I actually would like them to take control of their life, from spiritual to financial to their health. I'd like them to drink more water. I'd like them to decrease their salt intake, and I'd like them to do some form of exercise.
Okay. Okay. You mentioned stress. How does stress affect the body?
If I had that 100 job that stresses you out, if you're having family issues at home with your spouse or your mate or your children, it stresses us out. So we need to find a way to release our stress and to find out what works for us, because stress is different for everyone, but you have to find something that you love to do and do it every day for at least 30 minutes.
Okay, at least 30 minutes. It seems as though there's a large number of under 50.
Really measure it out. Don't just say, I think I had 4 cups. Get a 64-ounce bottle, fill it up, and start drinking as soon as you wake up in the morning. Decrease your salt intake. Write down, have a food diary. Write down, like, in general, what you eat for breakfast, lunch, and dinner, and snacks. How late do you eat? And then what do you do for exercise? Are you moving around? Do you have a sedentary job? Are you sitting at a desk? Are you walking around? That kind of thing.
Okay, okay. And what happens when we get this question a lot just about what people drink. What are some things that you may want to stay away from? People talk about milk not being good now, and some other things that people thought were good but are not good anymore.
I always say this, and people say it's a joke, but the medical community, we've now decided that, 1 glass of red wine is helpful to your heart. And I tell people, I said, probably 50 years from now, we're going to look back and go, wait, we made a mistake. It's really white wine. So I think we have to drink more water. The body is made up of a majority of water, so we have to drink more. There's a lot of problems. I'm a coffee drinker. 1 cup is fine. It's the sugar and the cream that we put in the coffee that's the issue. It's not the coffee itself. We found that this coffee does have some benefits. So I'd stay away from sugary drinks, these sugar-flavored water. Just drink plain alkaline water and stay away from sodas.
Okay, okay. Sugar, you said. Is there any sugar that's safe for us?
Oh,
Or should we just try to give up sugar just altogether?
Personally, I think we should try to give up sugar altogether. There's sugar in fruit, natural sugar, that's fine. I think the added sugar is the problem. So if you feel like you have to have something, I would do stevia. It has no calories. It doesn't have an aftertaste that some people don't like with some of the other Splendas and Sweet and Low, which have been linked in the future. It's linked to cancer. So I'd say stay away from the sugar. Use stevia. You can't acquire a taste for it. It's no calories.
Okay, okay. One question we get all the time about the body in general, just about knees, soreness. Is there any general advice you can give about somebody that's, maybe getting up in age, and then they've got soreness maybe in their back and their knees, anything like that?
That's a great question. It's probably one of the, if not the number 1, number 2 complaint in an outpatient office setting or even in the urgent care. One, I think it's our weight. You bear your weight in your back and your knees. So if you're overweight, of course, talk to your physician and get on a weight loss program. And I don't have a problem with telling people to use an anti-inflammatory, especially for athletes, men and women who start out young, playing football, playing tennis. If you've ever had an injury, we found out that later you're probably going to have a little arthritis. So I don't have a problem with someone to take an anti-inflammatory, but there's so many other things out there. One of the types of medicine I practice is homeopathy medicine or homeopathic medicine, and there are plant-based medications that can be used as well. But reducing your weight is going to reduce your pain in your back and in your knees, and you definitely ice is your friend. Elevating your legs is your friend, and using an anti-inflammatory or homeopathic medicine, or some topicals. They have topical things that are available: arnica, topical arnica, biofreeze, things like that that won't cause any other problems.
All right. So we're talking about from the womb to the tomb. So what can help us live longer? What have you seen over the years?
You know, I use my grandmother as an example. She was in her 90s, and my aunt lived to be 109, so I got to go to 110. And it's interesting because those individuals, and it's not just my family, just some of my patients that are in their hundreds and 80s and 90s, and you sort of interview them and ask, like, what did you do? How did you live this long? And it's amazing because it's not what we're taught. It's not what you would think. They said we eat whatever we want in moderation. And they eat frequently, every 2 hours, like we're supposed to do. And their plate is not the gigantic plate. It's like the size of a saucer, and it's colorful, and they eat every 2 hours. They're moving around. They're drinking their water. You know, some people say you're not supposed to eat pork, you're not supposed to eat beef. I found that in general, it doesn't matter if it's my patient or family members, the ones that live the longest, they usually are from the South. They, like I said, eat anything they want. They move around. They're not sedentary. They never have been. And it's in moderation.
Good question. So a couple more questions. You spoke about alkaline water. We get a lot of questions about alkaline water, what it can do and what it can't do. Can you speak about it?
Yes, I'm not an expert, but the body needs to be more alkaline because it's usually more acidic, and that's not helpful. That causes a lot of problems. It does taste differently, and I would say for the last, I can speak personally, I probably have been drinking alkaline water, I'm going to say maybe 8 years. It may even be 10 years, even more than that. It makes a difference. It tastes differently. I think you use the restroom more often, you urinate more often, you have bowel movements more often, and that helps with weight loss. It's just good for the body. The body needs to be alkaline. It doesn't need to be acidic.
Okay. Final question. Where can people find you online?
Well, even though I'm on Facebook at Dr. No, which is N-O, Knows, K-N-O-W.
Okay. Awesome. Well, thank you, doctor. Thank you for joining us.